Hello, this is Dr. Wilshire at Missouri Fertility. Welcome to our Ask the Expert series. Today we have Dr. Erica Bove, a board-certified reproductive endocrinologist. Good afternoon, Erica.
Hi, Dr. Wilshire. It's so nice to see you.
Erica, you have so much expertise on so many topics, but one that you are clearly very passionate about is giving women, and frequently professional women, advice on how to cope with infertility and life stressors and all that stuff. And you have an expression called mindful self-compassion.
That's right.
And that sounds, it's a mouthful, but boy, it sounds so important because I can tell you, nobody can beat me up worse than me. Right?
That's right.
No one is the worst critic than oneself. And it's easy when things aren't going well to beat yourself up and get in a rut and
That's right.
get depressed and anxious and all this kind of stuff. So please, with that introduction, Erica, give us your thoughts on mindful self-compassion and what can we do to optimize that?
Yeah, absolutely. And I think you alluded to this, Dr. Wilshire. I think that so many of us have a harsh inner critic, right? We have this negative tape that is just constantly not good enough, not smart enough, not, fertile enough, whatever it is. And with that comes a lot of self-judgment and shame, which then leads to a shame spiral, which I actually think makes our body shut down. So not only does it not feel good to be, sort of experiencing this level of self-judgment and shame, but I also think that because that space leads us to other things like shutting down and withdrawing from others and maybe even dropping out of fertility treatment, right? It really does affect our chances of overall success with this process. And so I really love the author, Dr. Kristen Neff. If you're listening and you want to check out some of her stuff, she talks about mindful self-compassion having 3 pillars. And I just love this. And so the first pillar is self-kindness. So that pillar basically is the opposite of self-judgment. So we ask ourselves, let's treat ourselves as we would our best friend. I'm sure most of us do not treat ourselves like we would treat our best friend.
Yeah.
Right? So how can I be kind to myself like I would to my best friend? It's a simple question, but it's so powerful, right?
Yeah.
So, and when those self-judgmental voices come in, we're like, wait, no, I'm gonna treat myself as my best friend. I'm gonna be kind to myself. And what does that mean? It means talking to ourselves with love, maybe even having terms of endearment for ourselves. It means, really challenging those thoughts that come if they really tell us it's our fault, we're not doing a good enough job, just really looking at those and offering love instead of judgment. So that's the self-kindness piece. I think it looks a little bit different for every single person, but it's so important to start to nurture ourselves back to that sort of calming home space that is our birthright. The second aspect of mindful self-compassion is actually mindfulness. And I think what gets us into trouble is either we're stuck in the past and we're regretting past decisions or we're judging ourselves for things. I mean, the past is truly done, right? There's nothing we can do. We can learn from the past, but there's nothing we can do to go back and change the past. So that is what it is. And, the future, the future anxieties, well, what if I don't get pregnant? What if I never get pregnant? What if I'm never a parent? What if I have another miscarriage? All these ruminations that happen, those are all in the future. And guess what? Those haven't happened yet either. And so if we can find a way to be mindful, and what that really means is engaging our senses, our 5 senses, which we're so blessed to have, right? Engaging those senses to get into the present moment. Because guess what? In this present moment, all is well. In this present
eternal
moment.
Now, how to get there.
That's right. And I help my patients and my clients, because I am a coach as well. I help people develop mantras that serve them, right? So I am resourceful. I am strong. I am supported. Maybe even I love my REI and I've gotten together my A team, right? That's important to really trust your REI and to trust the team.
That's great. I like that.
Right? So go ahead.
Yeah. I like telling people, look, you're playing with the big boys now. I mean, they say, well, this doctor told me this and I read this. And I said, look, you've been in the Pee Wee leagues. It's like one of my baseball analogies. You've been in the Pee Wee leagues, not to put them down, but you're playing with the big boys now, big girls now. You're in the major leagues. You've got a good team. And you can rest assured that we as board-certified reproductive endocrinologists, and our teams, our wonderful nurses and support staff and
That's
sonographers and lab people, et cetera, are there and is a wonderful resource. And you can be so happy and grateful that you have that resource.
That's right. And I think, as an extension of that, I think that we can get very hypervigilant, right, as patients, because we're like, I have to look out for everything myself. If I don't do it, nobody's going to do this. And I think that when you trust your REI, then you can let me be the doctor. I will take care of you. I even said to somebody this morning, I will get you pregnant. I am going to get you pregnant. I need you to let me help you, in that way. And you could just see the person's body just immediately relax because they're like, okay, I'm in good hands. And so I think we have to embrace that. So that's the part of mindfulness, like in this moment, all is well. And then the third component of mindful self-compassion is common humanity. I love this one. What that really means is anybody in my situation would feel this way, right? So it's like, like it just diffuses the personal, like, oh, it's just me because I worried too much, or I ate from the taco truck on Tuesday, or I can't see a life without children, so I'm taking this harder than other people. Like, I just like to say to myself, like, anybody in the situation would feel disappointed by a negative pregnancy test, frustrated with their partner who won't stop a toxic habit. Like, it just kind of says it's not me. This is the human condition. There is suffering. There is loss. There is sadness. There's also joy and peace and hope, of course. But it's not me. And it just sort of bridges us to the rest of humanity. So again, to summarize, so the 3 pillars of mindful self-compassion are self-kindness, which is the opposite of self-judgment, mindfulness, which is being in the present moment and really focusing on the resources at hand. And then the third thing is common humanity, coming together and not being so isolated.
Yeah. I just want to add a little footnote to this. Life is so unfair.
It is.
And I'm sure you hear it. We all hear it. A woman's having trouble, couple's having trouble conceiving, and they'll say, gee, there's this drug addict down the street, who can't stop having kids. And it seems so grossly unfair. And I tell people there is no answer. We don't know God's will. It's a mysterious universe. And all we can do is maybe the next right thing and realize we just don't know everything. We can't know everything. And it's part of our existence. It's kind of an answer. What do you say about that?
And coming together, leaning on each other, not going it alone. I think that really it eases the burden. And I think, when we can feel seen, when we can feel understood, when we can do it together, I really think there's a lot of power in that.
Yeah, especially when you have a compassionate doctor like you.
And you.
Yeah, I can look, just having somebody there hold your hand, look you in the eye, be honest with you, and get you through this
Hugs.
not
I'm a
unique
hugger.
journey.
Even if I don't care, I'm going to hug you.
I hug a lot of patients.
I bet you do.
And the husbands, too. I got a lot of, I call them chest bumps. I call them chest bumps, but I still give them a big hug anyway.
That's amazing. I think it helps. I really do.
Oh, yeah. Fantastic. Yeah. Well, Erica, thank you for your insight, and thank you for your time today. What a wonderful conversation with you.
Thank you, Dr. Wilshire.